Good afternoon and welcome to H360 Live. My name is Courtland Long and we have a really exciting show for you today. A couple weeks ago, Dave and I had the opportunity to sit down with Shauna Dukes via Skype. Shauna is a coronary artery disease patient who has undergone stent therapy, and we were talking with her all about the warning signs, her treatment, and how it's helped her to live a healthier and better life. So sit back, relax, and enjoy this conversation, and I'll be right back with you. Well, Shauna, thank you so much for joining us today on H360 Live. It's a pleasure to see you.
Thank you so much for having me.
So we have a lot of women in our community who are also living with heart disease, and I think that they'll benefit very much from hearing your story and how you were diagnosed and what your treatment plan was like. Can we start out by having you talk with us a little bit about the events surrounding your initial diagnosis of coronary artery disease?
Sure. I had no idea it was, it was anything I was going to be dealing with. And about 3 months ago, back in March, um, first of all, I live a very active lifestyle and I work out every day. I walk my dog 1.5 to 2 miles a day. And it was on one of those walks back in March when I was walking my dog that out of nowhere I had tightness in my throat, tightness in my chest, and numbness that ran down my left arm, and it literally stopped me in my tracks. And I just thought, gosh, that is so clearly heart related, but in my mind, I'm thinking, there's no way. It's just, that's not something that I've ever even thought that I would deal with. So I didn't do anything about it right away. And several weeks went by and the symptoms repeated themselves. And finally, they repeated themselves in a much more serious way, where I had jaw tightness in my throat, left side of my chest, numbness down my arm. And at that point I said, I can't ignore this any longer. And, that's when I called my internal medicine doctor and he got me in. And, it's crazy because probably 10 coronary artery or 10 heart related diagnostic tests later, we really didn't have any answers. I mean, I had everything from several EKGs, echo, stress tests, nuclear stress tests, Holter monitor, a Warning vent monitor. And at that point, I still didn't have any answers. And it was really crazy. I finally had a day of such severe symptoms. I really felt like I'd had a heart attack that day. Now, whether I did or not, I still don't, I don't know. And that led me to a cardiologist's office. And, I was given medication and told I had coronary artery disease and angina, given medication, and said, I'll see you in a month. And it just seemed crazy because I couldn't really go back to my lifestyle at all. I mean, I was somebody that worked out 6 days a week and just had a really, really active lifestyle. So it was crazy.
It sounds almost textbook, right? What you're
It was,
describing here, the tightness of the chest and the numbness down, one side of your body, sounds pretty textbook. So you get these tests and you're going through. So how did these symptoms then, by the time you started the test, you said a month or so goes by, still no answers. How were those symptoms affecting your everyday lifestyle? Did you slow your routine down, or what was going through your mind there?
yeah, I mean, obviously I did. And I was really probably doing some things I shouldn't have been doing because, I'd go get on an elliptical and within 30 seconds of being on an elliptical, I'd have these symptoms. And I thought, this is crazy. I can't continue to do this, and it was completely impacting my lifestyle. And it seemed, when you feel like the symptoms just came out of the blue and out of nowhere, and that's really the message that you want to get to people, is that I had nothing leading up to this. And I had, in my mind, I've looked now and I have some family history, but, I felt like I had the least risk factors of any person walking around. And in retrospect, my age, and I did have it in my family, gave me 2 risk factors. But those were things that, they're just, it's not in your mind when you lead an active lifestyle that you're ever going to be impacted by coronary artery disease ever. But yeah, it completely stopped what I was doing completely.
Well, Shauna, you had mentioned that you were put on a medication originally. What was your first treatment plan, and was that effective for you at all?
Well, my first treatment plan was a nitroglycerin patch, and then I had the little nitrostat that you put under your tongue in case you're having an angina, attack. And he was going to see me in a month, and it was effective, in that my symptoms lessened quite a bit over the next several weeks. But there's a lot of side effects. I felt like I'd gone from a very active person to, I mean, I don't want to exaggerate and say an invalid, but it wasn't quite that bad. But in my mind, for my lifestyle, I just couldn't believe, I literally couldn't believe that I couldn't do the things I was used to doing. I mean, it was just really shocking. So about 3 weeks, I was probably doing well, even though trying to manage the side effects of the nitroglycerin was not fun. And then I started having breakthroughs, like a little bit of tightness again, a little bit. And I'd asked that cardiologist, do you consider this a breakthrough that, we should look at something else? And he, he told me no, he thought I was doing fine. And that's when I just felt like, we got to know where this is coming from. We've got to know something else. This seems really crazy to give me medication and send me on my way. And so that's when, more prevalent symptoms while on nitroglycerin patch led me to just start figuring out I've got to see somebody else, and I've got to see somebody else who's going to take me seriously, listen to my story, listen to all my symptoms, listen to the whole story of never having a diagnostic test that came out anything but negative or normal. So through a friend who was familiar with literally almost all the cardiologists in our medical center here in Houston, I got in to see this Dr. Colin Barker on a day that I felt particularly, I felt like things were really serious when I woke up this one particular day. And he saw me that day without an appointment. And 2 hours later, I was in the cath lab with them putting a stent in my artery.
Yeah, it's shocking, right, to hear this. But,
It is.
and it just proves the point. I mean, you're leading this very active lifestyle. Nobody knows your body better than you, and something
Right.
is going
Right.
on here.
Right.
And you're put on this medication, and so I'm assuming then that stents were never even discussed with your first physician.
Oh, no. I mean, we didn't, yeah, stents were never discussed. We weren't even to a point of, I said to him, don't we want to know where this is coming from? And I didn't know whether that would involve a heart catheter or some kind of heart scan or something. I was just like, don't we want to know where this is coming from? And that was first and foremost in my mind. And, like you said, and you want to let people know, your own body better than anybody else. And I think you just have to, at some point, when you're not satisfied or you're not quite getting the answer that you want to get, you've got to push it further. You just have to. And I was a walking, ticking time bomb. When I got in that cath lab and got with this interventional cardiologist, I had a 90% blockage of my left anterior descending artery, which is also affectionately known as the widowmaker. Yeah. And I was a ticking time bomb. Wow. And it's really scary to look back and think, that. But, I got to the right person and I got the right treatment, and, it's been great.
So, Shauna, can you take us back to that first appointment with Dr. Barker where you went in and you went over your first treatment with him? What did he say to you? Did he say, we got to dig deeper, we need to do more tests? What was that like?
Well, he knew the urgency of the phone call that the referral friend made to him on saying, I think you need to see her today. Um, I actually had an appointment with him a week later. I had scheduled an appointment, but this particular day, the symptoms woke me up at 6 a.m. And I knew that day I was, really bad. So he knew he had someone coming in that, was probably more of an urgent, I've got to see this patient. That was my sixth EKG that I had in their office that day. And it was my first EKG that was abnormal. And so, I wanted to just say, yeah, I have an abnormal test. Yay. But he would have done what he did, whether I had a normal EKG or not. He really listened to me. He listened to the whole story of, I've had all these diagnostic tests. I've seen, an internist and a cardiologist. I was put on this. I still have symptoms. He really just said, can you go over to the hospital right now? And it was a relief to hear somebody say that. I was like, gosh, yes. I mean, I just was just really wanting someone to, to say, we've got to see what's going on here.
Yeah. Well, at least you're getting answers, right? I mean, you're not being turned away
Exactly.
saying, well, let's try this, or, maybe it's not that, and you're sent on your way. At least you go through this EKG, it comes back, it's a bad outcome. You've got an answer, and you can start getting some corrective action, and it sounds
Right.
like it's right then and there. So you go from the EKG. He says, boy, this is abnormal. Can you make it let's get over to the hospital right away. Then you arrive at the hospital. What happens? Is there more tests involved at that point?
No, they just started, I was in that prep area, kind of like an OR, waiting area where you're completely prepped for a heart catheter. Um, and you're waiting to, go in the cath lab, and it was probably only about a 2-hour process, and they worked me in that day. I mean, they had a full board full of people listed, and they worked me in, and I went into the cath lab. It's kind of an amazing procedure because you're awake the whole time. I knew the minute they said, "Oh, there it is," and so they thread that stent through the over the catheter. It's really an amazing procedure, and I have to say, I moved from that table to the gurney when it was all done, and I felt immediately better, which kind of told me I had, for the past several months, I had probably almost gotten used to not feel, not having this full, I guess, blood flow. It's crazy to think about, but it was immediate, literally immediate. I felt great.
Yeah, well, it's like trying to water your garden with a kink in the hose, right? I mean,
Yeah,
yeah,
that's
eventually you
that's.
just say, well, it is what it is, and this is
And I
how we're
said,
gonna
it's
have to deal
amazing
with it.
how great you can feel when you have full blood flow.
Yeah,
I mean,
yeah,
it was unbelievable.
yeah.
It really was. And so I just thought, oh my gosh, this whole ordeal. And I have my answer. And I never, when I wasn't getting the answers, I mean, a stent was never even in my thought process because I never, I didn't, I kept looking coronary artery disease, what are the what are my options and different things here. And I think because it all came up so suddenly in my life, I think maybe I would have, had a chance to look at treatment options and things like that. But I was just still looking for a diagnosis, I guess. I mean, I had a diagnosis of coronary artery disease. But, I just was trying to look for that first answer of the cause. I mean, what's going on.
Yeah.
Well, Shauna, before or after this procedure for your stent, did Dr. Barker talk to you at all about how this particular stent, which I believe was newly approved, had differed
Yeah.
from previous versions?
He didn't, because everything was so quick and get me in and do all this stuff. I learned right afterwards, I feel like such the beneficiary of state of the art technology. I think this stent was just introduced in November. So the Synergy stent, um, is an improvement, the whole evolution of stents and through all the decades. Um, I feel like, gosh, here I am, just a few months past of them introducing that product to market. And, I was a recipient of the Synergy stent. And it was after all of that, um, the the absolute best resource I had was bostonscientific.com/synergy patient. And I got on there and realized there's animation about, there's animation, what the stent does, how it's, how they put it in your artery, everything about it. The medication that's on it, when that goes away, when the polymer that holds the medication goes away. There were just all these things I learned on that website, about diagnosis, treatment options. I mean, everything you can imagine was there. And I thought, gosh, it's such a great resource for people who know they have coronary artery disease, to maybe go look at. And I'm sure there are others. So there's plenty of others.
So it happened so quick. So from the doctor's office, hospital, stent put in. Does Dr. Barker discuss then with you after the procedure is done what the recovery is going to look like and what his expectations are and how maybe he calibrated or set your expectations on the recovery?
Amazingly, I also had a heart catheter through my wrist. And in many instances, people have heart catheters through their groin, which is a lot longer recovery. So I felt very fortunate that I was also with an interventional cardiologist who is doing this where and I don't think all of them are, well, I know all of them aren't. There's only, a certain amount of them that are going through the wrist. So he told me your recovery is going to be lessened by, a great amount. And he was right. Within 2 days, I went home and rested and all. And I would say within 2 days, I was up and running errands and doing some things. And you feel like I felt like something foreign a little bit was in me. I just kind of had this feeling that, you're not back 100%. But by the end of that week, I was out because they told me, the therapist, the occupational therapist who takes you up and gets you walking and all that kind of stuff said, you can walk this week. In fact, walk whatever you want. I was out walking 2 miles, then 3 miles. I mean, by the end of the week of having a stent, I was walking 5 miles. So I thought, this is incredible. I mean, I really, truly had my life given back to me. Now, I wasn't going to see Dr. Barker until a month. And so my follow-up with him was a month. And I I actually said to him, you're going to have to spell out what I can and can't do because I will go back at this, 90 to nothing, back at my workouts, all of it. And he looked at me and said, you have no restrictions, none. And I really thought in that moment, oh my gosh, my life had been given back to me. I mean, it really had been given back to me. I didn't realize it had been impacted so much. I just thought, when I didn't have answers, I thought, is this my new normal? It's crazy to think this is my new normal now. And, I'm 58, I feel very young, and I just couldn't believe it. And then when he said, you have no restrictions, I just thought, God, everyone should know that this is an option. If they're dealing with coronary artery disease. And it obviously if they're under the care of a doctor, they need to be discussing their treatment options.
Shauna, do you have to do anything to maintain the health of your stent, or will you have to have it replaced at any time? Did Dr. Barker mention anything about that?
No, apparently, I don't. I see him again in December. That's another follow-up. But as I understand it, no. And, it's great to know that when they were, when they looked at everything in the cath lab, I mean, one reason I had no restrictions is I had a very, very healthy heart and arteries, and really only this one place of this, I guess little explosion that was a 90% blockage. Everything else looked healthy and good, which is, I mean, it's a double-edged. I know people say, boy, if this happened to you, Shauna, um, you know, what about people who don't take, obviously it doesn't matter if you take care of yourself. And boy, I have argued that because I've said, I don't think the cath lab is necessarily a happy place for some people that go in. They find all kinds of other unhealthy issues going on with their heart. And for me, they saw everything was in great, great health and shape. So, it really was great. In fact, the funny thing is, when he told me I had no restrictions, I went back to working out. I go to classes about 6 days a week. So I, tried to start out a little slower and go back to working out. And about a month and a half later, I participated in the University of Texas has a women's clinic with their head coach and their other coaches and some of their players. And that it was July 30th, and it was 100 degrees on the field. We went through 13 stations. We ran the stadium steps. We pushed sleds. We did everything. And it really was my moment of my Rocky moment of getting to the top of the stairs of the steps and just saying, I just had a stent put in. I mean, how crazy is that?
Yeah.
So it was great. It was great.
Well, there comes a point where you put the helmet on and tighten that chin strap up, and you're back in the game, right?
And I really was. I
Yeah.
really was. I
Well,
really was.
fantastic to hear. So now you're back to your working out, your routines, your classes, your walks, and
A hundred
life
percent.
is good.
Yeah. Life is good. 100%. And you just want other people to um, just don't stop trying to get those answers. I could have gone back to that same doctor, and he is a good cardiologist. He is. I just felt like, I've got to go somewhere else, and I've got to get different answers, and I've got to get a different perspective. And I think if people get a second and third opinion, they get a different perspective from someone. And, it's your life, you're your own best advocate. And, you just really have to be the one that doesn't stop pursuing when you don't quite get the answer that you're looking for. And there's nothing wrong with that. Every doctor will tell you, go get a second opinion or a third opinion. So that's really what you want people to know.
Well, speaking of being your own best advocate, I think it's something like 1 in 3 people are unaware that heart stenting is even an option. And so, given the prevalence of heart disease within this country, why do you think we're so unaware of this this incredible treatment?
Yeah, I know. And I was one of those people. Um, and I think for someone like me, where it's never been in even your realm of thinking that you could possibly have heart disease, the last thing you are thinking about is stenting an option or anything like that. But I think that's where when people, start searching coronary artery disease and then treatment options, there's a lot of information they can go to and they can find, about stents. But I think that you're completely right. I mean, it's not an option that people particularly know that's out there. And, especially when they're just first diagnosed with coronary artery disease and they haven't quite gotten to the answer of you have a specific blockage.
Mm-hmm.
So you're obviously out waving the banner and being an advocate for other women and
Yeah.
men, and actually for the stent process. What are some of the things that you're getting involved in at the local level to help build awareness?
Well, I've, Dr. Barker and I did a whole series of interviews. We sat in a studio one day and we talked to 19 media outlets within a several hour period. And it was live radio, lots of different web, series with the video and things like that. So, and then I'm working with Boston Scientific on trying to find opportunities of places that we really can get the word out, because what I really want women to know, I had clear-cut symptoms. Most women, in fact, I feel like mine was unusual for a woman, that I had that tight, profound tightness in my throat, tightness down the left side of my chest, numbness that ran down my left arm. You don't have to know a whole lot of information to know that's clear cut, heart related. And I feel like a lot of women have, heartburn, something's uncomfortable, their shoulder pain, different things like that. And I just really want to get the word out is that if something has come, out of nowhere that you haven't experienced before, symptoms you haven't had before, it's new to you, go get answers. And it's hard when you're look a certain way, maybe you're a fit woman I know, even though doctors know that it's so prevalent in women, even they, after a while when most of their patients are a certain type of male, you can be dismissed. And I'm not saying they're doing this, on purpose or any kind of thing like that, but that's where women have to just be probably doubly diligent in getting, just continuing to insist on testing, insist on answers, and then going to the next doctor when it doesn't happen. Because I can't preach that enough. It really did save my life. It saved my life.
Well, when other women or even men come to you and they talk to you about maybe being diagnosed with heart disease, how do you talk to them about stenting as a treatment option? Do you say immediately like, oh, you got to check this out? Or do you sort of let them go through their primary course of treatment first?
Well, I tell them immediately what saved me, which I truly believe. Like I said, I'm a recipient of this really amazing state-of-the-art stent. And I tell them about stenting because I don't think people know about it. And I certainly, I know it, I guess, but it's just something foreign that, you're not thinking about. And so certainly if anybody either I talk to that has risk factors for coronary artery disease, but don't have anything or have never been diagnosed, I want to tell them about stenting and that is an option. And then anybody that has been diagnosed with coronary artery disease and maybe managed with medication or thinking, my gosh, you can have your complete life back, and some people need a couple of stents or, multiple stents. And, I only needed one. And I'm not saying every single individual is different, obviously. Some people don't have as healthy of a heart when they get in there and see what all is going on. They find a multitude of, things going on. But I really do want first and foremost for people to know about stenting and the fact that it's a lifesaver, a complete lifesaver, and just it restored everything for me.
Yeah. So have any of the symptoms reappeared since your stent?
No. In fact, no. I'm just like nothing, and I don't even anticipate that it will. And I don't have a follow-up with my doctor again until December, but I do know that unlike older, stents throughout all the decades that may need to be replaced, that people have to really find out, do I need these stents replaced? The Synergy stent, it really is, semi-absorbable. I mean, into your artery. It becomes a part of your artery. And so they've really, with this technology, they've lessened all the side effects of maybe inflammation in older stents and things that caused other problems. The Synergy stent has kind of solved a lot of those problems. So, gosh, I don't even anticipate ever having a problem again. I mean, obviously, I'll be under the care of a cardiologist now, but I don't anticipate ever having a problem again for the rest of my life.
That's incredible. Well, Shauna, do you have any final thoughts, words of wisdom, or advice for anyone who's been newly diagnosed?
Not to be so repetitive, I really want people to be their own advocate. Never stop trying to get an answer. We have a plethora of information on the web, and let that information lead you to a doctor to ask questions, possibly the next doctor to ask questions of, and just never give up at being your own advocate, because it's the difference between life and death. When I really think about, I was walking around, like I said, like a ticking time bomb. So that would be my best advice for other people. And especially if you've been diagnosed or you have a history, you have a father, you have a mother, mine was further in my family. So it wasn't in the forefront of my mind. It was like an uncle and cousins. But if people have risk factors, they should get information. Just be armed with a lot of information.
Yeah. Well, Shauna, incredible journey, incredible story. You look great. We're so happy to hear that you're doing great, and send our best to your physician and your care team and your family. And we really appreciate you spending some time with us today and shining the spotlight on coronary artery disease.
Thank you. I appreciate it. Thank you so much.
Well, I hope you enjoyed that conversation between me, Dave, and Shauna. Thank you, Shauna, so much for joining us on H360 Live. We'd like to thank our viewers for tuning in and our sponsors for making it all possible. Remember, all of our episodes of H360 Live can be viewed on demand at healthyo360.com, and our podcast can always be found in the iTunes Store. We love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest, using the hashtag #RealStories when posting. On behalf of Dave Duplay, myself, and the entire Healthyo360 family, we'd like to thank you again for joining us today, and we look forward to seeing you next week. I never had